Hello and welcome to Medical Dialogues. I'm Dr. Bhumika. Here is what I bring to you from the world of medicine. Low sugar diet in first 2 years of life may lower risk of diabetes in adults. A low sugar diet in utero and in the first 2 years of life can meaningfully reduce the risk of chronic disease in adulthood, a new study has found, providing compelling new evidence of the lifelong health effects on early life sugar consumption. Published in Science, the study finds that children who experience sugar restrictions during the first 1000 days after conception had up to 35% lower risk of developing type 2 diabetes and as much as 20% less risk of hypertension as adults. Low sugar intake by the mother prior to birth has enough to lower risks, but continued sugar restrictions after birth increase the benefits. Taking advantage of an unintended natural experiment from World War II, researchers examined how sugar rationing during the war influenced long-term health outcomes. The researchers used contemporary data from the UK Biobank, a database of medical histories and genetic, lifestyle and other disease risk factors to study the effect of those early life sugar restrictions on health outcomes of adults conceived in the UK, just before and after the end of wartime sugar rationing. Sugar intake during rationing was about 8 teaspoons per day on average. When rationing ended, sugar and sweets consumption skyrocketed to about 16 teaspoons per day. The immediate and large increase in sugar consumption, but no other food after rationing ended, created an interesting natural experiment. Individuals were exposed to varying levels of sugar intake early in life, depending on whether they were conceived or born before or after September 1953. Those conceived or born just before the end of rationing experienced scarce conditions compared to those born just after who were born into a more sugar-rich environment. The researchers then identified those born around this time in the UK Biobank data collected over 50 years later. Using a very tight birth window around the end of sugar rationing allowed the authors to compare midlife health outcomes of otherwise similar birth cohorts. While living through the period of sugar restriction during the first 1000 days of life substantially lowered the risk of developing diabetes and hypertension for those who were later diagnosed with either of those conditions. Onset of disease was delayed by 4 years and 2 years respectively. Notably, exposure to sugar restrictions in utero alone was enough to lower risks, but disease protection increased postnatally once solids were likely introduced. Thank you for watching Medical Dialogues. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.